Speech and hearing impairment refers to communication difficulties due to speaking and hearing problems. Individuals with these conditions require specialized interventions to improve their quality of life and communication skills. We take great pride in introducing Dr. P. Manjula, Dean for Research at the All India Institute of Speech and Hearing, popularly known as AISH, Mysore, India. Dr. Manjula has not only inspired speech and hearing individuals, but has also helped them to navigate these challenges and achieve remarkable success. To delve deeper into this, we now invite Dr. P. Manjula. It's a privilege to have you here with us now.
Humble pranams at the lotus feet of Bhagwan Sai. This is done with the first slide, please. Yeah. So I'm going to, today in the morning we had the exchange of MOUs between Satya Sai Institute of Vidya Vaini and SSSVV and then our institute. I'm very happy and excited to work with such a committed team. So I'm really happy to go ahead with that. Our institute gives full support to it. Our director, Dr. Pushpavati Madam, has asked us to convey this. Thank you. And regarding the topic on fostering the inclusive education, inclusive environments for empowering individuals with speech and hearing impairment, actually, being a speaker towards the end of the summit is an advantage as well as a disadvantage, because some of the points that I wanted to cover has already been covered also, and it has been covered so well that I don't have to dwell at it again. And I'm just going to briefly touch upon some of the areas which are more specific to my area of speech and hearing impairment. I'm basically an audiologist from All India Institute of Speech and Hearing, so I may be putting more information from my point of view, though not specifically on special education aspects or maybe education aspects. Okay, so next slide, please. So this is our institute, All India Institute of Speech and Hearing. I just want to tell about this because if there are any individuals who require our services, then definitely we will be happy to serve them. So our institute, All India Institute of Speech and Hearing, is one of its kind in the entire nation, and it's an autonomous body under the Ministry of Health and Family Welfare, Government of India. So here we have 4 verticals or 4 objectives, under which we have manpower as one of the objectives. So in this manpower generation, we have courses starting from diploma, bachelor's, post-graduation, doctoral and postdoctoral degrees. And under the bachelor's, we have the bachelor's in audiology and speech language pathology and also bachelor's in special education. So we have this special department of special education, which is very resourceful, and they'll be very happy to collaborate with you all from the SSSVV team. So that is about the manpower generation, and then we have clinical services as one of the other verticals, where we give services such as assessment and management of individuals who have problems in hearing. Hearing problems can happen any time in life. It can be at the time of birth or at the time in old age. It can happen, and everyone in all of our families, there will be either 1 or 2 individuals who may have developed a hearing loss or who may have had a hearing loss in their childhood. Some of these problems are treatable. So early identification and early intervention is very important aspect in treating this, so that the child, in case it is there from the birth itself, so if the child is intervened early, then the child will cope up well in the classrooms during education and get good educational achievements. So apart from this, we also have research as one of the objectives, where we have the development of certain assessment tools, management tools, and special collaborations with to come out with interdisciplinary research outcomes. We have all this, and then nowadays we are encouraging more of research collaborations with educational institutes and with also our alumni who graduated from our institute and who've been placed at different research centers and different academic centers. And last but not the least is the public education, which we have as one of the objectives, and where we try to disseminate information that we have about all these disorders that we are dealing with in our institute. Like you have the hearing problems or speech problems. Speech problems can be something like just a mispronunciation or a misarticulation, we call it, or a phonological disorder, where the child will say one sound instead of saying another sound. Something like if the child is not able to say r sound. Okay, so the child may substitute with th sound. Okay, so for train, he may not say, he may delete that r sound from the word. So it may sometimes mean something else, or it may, for the people who are understanding, I mean, who are with the child, then they can understand. Only those individuals can understand. So the communication becomes difficult there. So because of all these problems, it's very important that we actually identify. For the next slide. So as has been said earlier, Mr. Saurabh Saxena had very well depicted this, okay, in his talk, where he said a lot of learning happens through a lot of sensory inputs and a lot of motor inputs and all this. So learning can happen with good support from hearing, good support from vision, and also if there is good speech and language, the child can achieve more, okay, the person can achieve more in educational setups. Okay, so the other factors that are required for educational achievements, something like education, the affordability for education, or good school, good support from the family members and all this. We have another slide. But however, when there is a hearing loss, or if there is a speech and hearing problems, what happens is, with hearing loss, for example, here we have two kids there on the top. So if this child, so can we say which child has got a problem there? So obviously, we have the child on the top panel. We have the child who has a problem on the left arm. Okay, so it is just visible, whereas hearing problem is not visible. It is invisible. So the problem goes unnoticed. So this is the main reason, or one of the reasons where the identification becomes a problem. It is identified at a later stage, and because it is identified at a later stage, the difference between a typically developing child and a child with hearing problem increases as the child grows, and it will be very difficult to bridge the gap. So early intervention is the key for success with these children. Okay, so there are other forms of disabilities which bring about speech impairments. You can see here on the lower right side of the screen, we have what is called cleft palate. Okay, so there is a cleft in the lip as well as in the palate for the child. So it's so difficult for the child, even for eating or drinking. Later on, when the child starts speaking, there'll be problems for this child to speak intelligibly. So because of all this, an early intervention, so it can be managed well with surgical interventions and also with speech and language interventions that are instituted early. Okay? So if the hearing problem is there, then the child will have to be using a hearing aid or a cochlear implant depending upon the severity, but not that all children require a hearing aid or a cochlear implant. There are certain kinds of problems that can be treated medically or surgically, that is with medicines or with surgeries. The ENT surgeons are able to cure the hearing problems. However, there are certain problems which, if it is there in the inner ear, then it may not be possible to cure. So we should identify where the problem is and to what extent the problem is so that the child can be appropriately intervened. So if the child has got a speech and hearing problem, then the child, for example, if the child has a problem in speech in the classroom, his speech cannot be understood by his peers or his teachers, and the child can have delayed development of speech and language, or it can be something like non-fluent speech. If there is stammering and all, the child may have problems in communication. So because of stammering, the child may not communicate with others. He may be preferring to stay alone. And because of all this, there can be some psychological or social problems also within the child. Okay, so one problem leads to another problem. So because of this, his social life will be affected, his quality of life is affected, and ultimately maybe the job placement or satisfaction is also affected. Like that, if the child has got a hearing problem, the child is not able to hear what the teacher is saying properly. It's not just the not able to hear, because if you go near the teacher, maybe the child is able to hear that. But sometimes what happens is if the auditory pathway or if the higher centers of the brain are involved, then whatever is heard is also not understood correctly. That also becomes a problem. So it's not just the problem of hearing, but it's also the problem of understanding. So we should properly identify what kind of problem the child has so that the child can be intervened appropriately. So if it is a problem of just the hearing, just providing a hearing aid or providing some amount of speech and language therapy might help them. But if the child has got problems in higher centers of the auditory cortex, then the child may require some amount of a different kind of assessment, some different kinds of management, which an audiologist will be able to do. Okay, so with this, there are certain factors, okay, which will foster better achievements in educational setups for a child with speech and hearing problems. These factors will include, as I mentioned earlier, early intervention. So early intervention starts even at the time of birth. So at AISH, we have newborn hearing screening programs where our staff go to different hospitals, maternal hospitals, and do the hearing screening there itself. The communication problems are screened at the time of birth. If the child does not cry immediately after birth, then there can be problems for supply of oxygen to the different centers of the brain, and there can be problems later on with other aspects. It could be general development problems, it could be intellectual problems, or it could be speech problems, it could be hearing problem, it can happen, something like that. So at the time of birth itself, there are certain equipment that can be used to find out if the child has got problems in hearing. There are different checklists that can be used to find out if there are problems in hearing. So we have specific environment there which are used for testing, and also we have specific training which should happen for a child starting from an early age itself. Okay, if the child is brought at a later age, at the age of school, for example, okay, so then the difference between the child with the problem and child without the problem increases, and it's very difficult to bridge the gap. So it's very necessary that we identify the child at an early stage, refer them to an appropriate rehabilitation, and then we start working early. And then for children with such problems, we also have facilities of preschool training. So preschool training was also in alignment with some of the programs of SSSVV. Okay, you had the SOPAN program. So that aligns with our preschool training program, where small groups of individuals with similar disabilities or similar impairments are considered, and they're given training in terms of educational achievements, in terms of academic skills, motor skills, communication skills, or pre-academic skills, and all these are trained. So this should start happening from an early stage itself, so that the child will have lesser problems. So if the child is going to the school, and then some of these problems, hearing problems and speech problems, can be acquired even at the age of school age. It's not just at the level of birth, but it can occur at later stage in the life, at school also. Sometimes there can be a lot of ear discharge, because of which there can be problems in hearing. And it can be a temporary problem also. So even in such conditions, the child may have a lot of problems in communication or understanding what the teacher is saying. But the teacher may assume that maybe the child is not hearing, or maybe the child is not paying attention. So we should understand first what the problem is, and then refer to an ENT surgeon, get it cured, and then so that the child will have lesser problems. If this is left untreated, if the teacher or if the parent ignores this, saying that it will get cured on its own, then it may lead to higher problems, such as this ear discharge or ear infection can cause infection even at higher levels, such as brain fever, meningitis, or encephalitis. So it should be treated early, and if there is a brain fever, encephalitis, and meningitis, the child can have severe problems if it is not treated early again. So At school levels also, we have programs such as school screening programs at schools. Most of the times, once in a year, we have medical screening camps, and medical advices are given. And during those camps, we should also include screening children for speech and hearing problems, so that these problems are identified at an early stage itself, and then they are managed well. Okay. So, and then at school, these children can be having another child paired with another child, so that this child can help, because teacher will have to look into maybe 30 students or 40 students in a classroom. The teacher can guide one of the buddies who's sitting next to the child with a hearing problem or a speech problem, so that this child can help this child with a hearing problem in all the activities of the school. Okay, so for this buddy should understand what really the problem is and how the person can help this person with a hearing problem or a speech problem. So what happens is sometimes we recommend a hearing aid, and the child goes to the classroom with the hearing aid. What happens is sometimes the child wouldn't have used the cell within the hearing aid. So if the child is not wearing the hearing aid with the cell, then the child can't hear anything. Okay, so it's actually just a hearing aid that is seen as the child is being worn, but actually it's not functioning because there is no cell. Or sometimes what happens, the cell might be put in a reverse order. The plus and the negatives may be interchanged. So that way also the hearing aid may not work. Sometimes the voltage of the cell may be reduced and the hearing aid may not work. So because of all these reasons, if there is a friend or a buddy who's sitting next to the child who's been trained on all this child can check whether the hearing aid is functional. Every day in the morning, the person who's sitting next to him in the class should check and to ensure that the device is functioning well. Sometimes what happens, even with another device called cochlear implant, there can be problems with maybe again the cells are not being charged, or maybe the wire which is cut there and the signals are not reaching the inner parts of the system, so that it's not heard. So in such cases, what happens, the device is given free of cost from the government. But what happens is the child, because of the maintenance cost, sometimes these children, they stop using the device. Okay, so this device, which costs about 8 lakhs in the market commercially, okay, is given free of cost from some of these governments, state governments, and even from the central government. But because of want of maintenance charges, these parents are not able to afford for it. And we should tell them, these children are also getting every month, this child, if the child has got a 70 dB and more of hearing loss, this child is going to get some amount of financial aid from the government. So this aid that they get, financial aid that they get from the government, can be kept in the bank in the name of the child, so that for all these expenses, we can ask them to utilize this amount, so that there is continuous usage of this device and continuous benefit from these devices. So we should advise these parents regarding that. So we also tell them, but they may forget at the time of at the time when there is a problem, they may not remember what we have said. But if we educate the teachers in the classrooms, we usually go to the classroom. You can see there in the second row, the last picture there. The audiologists and speech pathologists, they go to the classrooms and educate the teachers in these aspects, okay, how they can help them in the classroom, and also what all they can do to help children wearing other devices. And they also tell them, sometimes what happens, the other curious children, they try to pull out the device. Okay, they try to pull out, and a couple of kids have come to us saying that the friend has stamped the device. Okay, it has thrown the device on the floor and stamped it, so it stopped working. And some of the devices, they've just flushed into the toilets, the children. So they do not know the value of the device. So we will have to counsel them. We would have the audiologist and speech pathologist role, and even the special educator's role will be to tell the regular teachers about the importance of maintenance of these, why the children are using this. And maybe I can give you an example of me wearing a specs. If I don't wear a specs, then at the end of the day, my eyes start burning. Okay, I feel uncomfortable, I get headache. Okay, but similarly, if a child is not wearing a device, at the end of the day, the child will feel fatigued, stressed. Okay, so he's not able to understand what the teacher. So sometimes what happens, this it gets reflected as a behavior problems because the child is not getting auditory inputs. So he starts getting distracted. He disturbs other children. He pulls the hair of another child. So this happens. So we think that the child has got a behavior problem. Actually, the child may have a hearing problem or some other problem, but it gets reflected as a behavior problem because these basic problems are not attended to initially. And we also have something like curricular support services, where for older kids, at lower end, we have preschool services, and then we also have at curricular support services where the special educators invite these children who have got specific problems in specific subjects, and they do all these adaptations and modifications that have been dealt at length earlier in earlier presentations. That training is also done with curricular support services. And we also have yoga and meditation classes, not just for kids, for parents, because parents are so stressed that even they need some amount of relaxation. So we have some of these programs which are targeted for the parents of the children having problems. Okay, so this one was also beautifully. This is just a downloaded picture, a freely downloadable picture from Google. Okay, so here we can see if there we have equal opportunities where all the children, even though they are of different heights, they are giving a similar height stool so that they can watch the cricket being played. Whereas here, the assumption is that all of them should be given equal opportunities so that they overcome their problem. Again, the problem is not solved with the problem if you convert that into a hearing problem, we can say that hearing problem is of different degrees. For example, some may have milder problems, some may have bigger problems. So those individuals with bigger problems will require stronger gain hearing aids. So those individuals with lesser problem will require lesser gain of hearing aids. So we can't just buy a hearing aid online, or we can't just buy a hearing aid over a counter. Okay, we have to go to an audiologist and get the appropriate device. It's no matter it's not just for a child. It can be for anyone who has a hearing problem. They have to go to an audiologist, get it tested, and then it will be more useful. Because sometimes if the child has got lesser problems, if he buys a hearing aid of strong gain, it will do more harm. It will damage the hearing. Because like sometimes even a louder amount of noise, even if it is music, if it is loud, it can damage the hearing. So something like this, you have a rubber band. If you pull it to a certain extent, it works. But if you stretch it even longer, then it breaks, isn't it? Like that, hearing also, like some amount of intensity, it is functioning optimally. But if it is very high intensity or very loud exposures for a longer durations, then it may damage the hearing also. So we should also educate the child regarding this. Many of these children are in a habit of listening to mobiles, music, and all these. Nowadays, it's becoming more and more rampant. So we will have to educate the child regarding the usage of these devices at a lower level in case they are led to use. Okay, so we have the other second picture there where, depending upon the height of the child, this different length of stools are given there, like that. As I told you, if you have a hearing problem, lesser hearing problem, a different hearing aid, more hearing problem, a different gain hearing aid. So here you can see that the obstacle that is there, which is opaque, is removed. So all of them can see the cricket without any hurdle there. So here, that means to say, if the child has got a problem with hearing, if the problem is in the outer ear or middle ear, there are three parts of the ear, the outer, middle, and inner ear. So if the problem is there in the outer or middle ear, it can be cured with medicines or surgery. If the problem is, so that can be that. Okay, so it depends on where the problem is, what the problem is. It has to be assessed well in order to be managed well. So that's the reason. First, we should see whether it can be managed well with any of these management techniques or management strategies so that these children can benefit well. So there are other factors other than the devices. So in a classroom, we should also worry about illumination. So here, the lights are there at strategic locations. So in a classroom, if the lights are there, if the light is falling on the teacher's face, then it's easier for the children to look at the teacher's face and understand what the teacher is saying. So lighting in a classroom also becomes very important. So this also has to be taught when constructing or when setting up of a classroom for children. It need not be a child with a hearing impairment. It helps children with any child, okay? Even with a normal or typically developing child, this illumination or lighting, proper lighting will help them. In case, like in the top figure there, we have 2 windows there in a room. That's a line drawing. So children are sitting there, okay? And the teacher is also there. So in this kind of situation, the light is falling from behind. So when the light falls from behind, it may cast shadow on the face. The child is not able to see the face of the teacher. If the child sees the face of this teacher, then lip reading, speech reading becomes easier for a child who's having problem in hearing. So it's always best that the light falls. So if the seating arrangement is reversed, the children are made to sit this side and the natural light falls on the teacher's face, then it would be a better position for the teacher to speak. And about the room acoustics in classroom, noise is one of the factors which we should consider. Now that I'm speaking here, there is a good microphone system which is amplifying my speech, and people at the back can also hear that. But if I stand here and speak, okay, I can cover a little bit of distance. People at the back will not be able to do it. Will not be able to hear me. Okay, so the distance matters in classroom. Okay, so if there is a problem, if there is a larger classroom, then the teacher will have to speak loudly, and when teacher speaks loudly, again there will be a problem with voice of the teacher. The teacher is not using an optimum voice. The teacher may have voice problems. Okay, sometimes there'll be no voice at all with the teacher. All this can happen. Being teachers, some of you might have experienced this. So it is not just the distance which can cause this, but there can be other, at other times what happens is children are making noise in the classroom. To override that, the teacher will have to speak loudly. Even that might cause problem in the voice. Okay, so we will have to make, it may not be possible to have some microphone systems like this or public address systems like this in every classroom. It may not be possible, but we should think of some ways of doing it. Maybe with CSR funds, we can request them to provide it by stage so that we can have some relief to the teachers also and their voice. Seating arrangement, as I said earlier, the lighting and the seating arrangement, if it is in a preferential, and as Madam Malika talked about, in groups. Okay, so that will also be helpful. Number of children in the classroom, if there are more children in the classroom, again, more distance the teacher's voice has to carry. So we will have to think about the teacher's voice and her well-being also. And then the ratio of hearing impaired child to the normal children is also something like maybe in a classroom there can be 2 to 3 children with problem having disability, or so that the teacher can cater to them efficiently. If there are more children, then it will be again having subsections so that the teacher may not have overburden. Okay, so noise, we can see here the distance. As the distance increases, the noise level may be the same, because there can be AC outlets somewhere all around this hall. But my speech, if I don't use this mic system, my speech keeps on decreasing, but the noise level remains the same. At one point, what happens is, those who are sitting in front can hear my voice, but the noise levels are at a lower level. But as the distance increases, the noise level becomes more and the voice level becomes less. So the people sitting at the back will really have a problem, or children sitting at the back will really have a problem. And that's the reason children with hearing impairment, especially with hearing impairment, they have to be seated in first 1 or 2 rows in case you have classrooms where you have desks and things like that. So first 1 or 2 rows, if the children are made to sit, and not towards the class walls, because near the walls there'll be lots of reflections of sound. So if the reflections of sounds are more, then the child with hearing impairment who's using a hearing aid will also have problems. The direct sound and the reflected sound may impinge at different times, and this may cause more distortion. Okay, so if the child is towards the center of the classroom, then it will be more useful. And something like this hall is a very well sound-treated room, so there is less of reflections. But if there are reflections, then the windows have to be curtained. Maybe cotton curtains can be used, but even this may not be practical in all the classrooms. Okay, so cotton is preferred for curtains because cotton absorbs in a better way. The direct sounds is absorbed before it is reflected. Okay, the synthetic curtains will slightly reflect more amount of sound than the cotton drapes. And about the color contrast that we use, all teachers are familiar with the color contrast if they're using PowerPoint's presentations or maybe a whiteboard on which color has to be used while writing or making PowerPoints. Okay, so black and white is good contrast. You have yellow and black, again, being good contrast. Here on this side, you have red and blue, which may not be a contrasting color there. So gray and white may not be a contrasting color. Green and black is a good contrast. So depending upon the contrast that is there between the two colors, we have to choose making the PowerPoints. And here you can, like this does not apply for existing schools, but if you're planning to construct a school, then when you're constructing the school, so you have the corridor here. This is the corridor, and these are the classrooms. Instead of having the doors here opening into the corridor, pocket doors can be thought of, but again, it may not be too practical. And hexagonal classrooms, instead of square classrooms, hexagonal classrooms can be thought of because it reflects less amount of sounds. Okay? So for the teacher, they have to use their optimum voice, they have to use their clear voice so that they are conveying well, and then whatever the child is speaking or hearing, they have to give some time to the child to respond. So all these are some of the parameters which the teachers can follow so that children with speech and hearing impairment, they fare well in their education. All these have been covered using simple words, simple language, rephrasing instead of repeating. If we repeat the same thing, the child may not understand. If you rephrase and tell with different words, the child may be better able to understand. One instruction or simple instructions at a time. All these have been covered earlier. Some of the tips, again, all these covered. And nowadays, we also have online classrooms. We will have to prepare ourselves, okay, for tele classrooms where, you will have to think about having good broadband facilities. And most of our kids may not have from a BPL family, if they will not have even smartphones. It's very difficult for them to attend these tele sessions. So maybe with CSRs, if we can have some of these funding provisions, what we do at our institute is assessment and management is also done through tele-assessment for some of the cases who are far off. So for them, it will be very useful. During COVID times, we had a lot of problems having to cater to some of these children who were attending therapy and all. So at such times, when we have smartphones with them, when somebody can sponsor that to them, it will be very useful. So again, these are some of the aspects which were covered earlier. Some of the devices which are available for these kids. So newborn screening I was telling you about. And then classroom amplification system where the teacher's microphone and then strategically located speakers are there in classroom. And then if for a cleft palate, some prostheses which can be made so that speech is made clear. All this has to be done at an early age for the child to benefit more. So with this, I'm going to complete the presentation. Thank you. Thank you for listening.
Thank you, ma'am, for giving us an insight on speech and hearing impairment, the need for early intervention, and the way forward. Thank you, ma'am. I now request Dr. Akhila Indurti, Sri Satya Sai Vidya Vahini Mission English Lead, to do the honors.